technical head of it, who designs and who are working for the programs. Yeah, so yes, so we are based in Bangalore, and we cater to the service part regarding the sports injury management and rehabilitation and performance enhancement, where we have a couple of people with physiotherapists, strength and conditioning coaches, um, and also the sports medicine consultants along with us. Uh, and apart from that, we do have our Academy of Sports Sciences, which delivers more of certificate programs and on field, off field programs, which we're now we are associated with SPAA also, and providing well versed programs, which are of certain durations. So it's certificate programs which are we are delivering it. Uh, that's it. I think Himanshu, you can come in and you can uh, give your inputs.
Thank you, Dr. Gopakumar sir, and thank you, Devaroda sir. It's a pleasure to be here on this platform, and it's actually an honor. I am Dr. Himanshu Tiwari, a sports physio, founder of 69 Fitness Street, and it's actually an honor to be associated with SPA and CAS, and it's an amazing initiative, joining hands with Armenia and helping to create a difference in the field of sports physiotherapy and training procedures. So we are into the same initiative, and our basic approach is to create a difference between the training potentials and the professionals, so that how we actually try to initiate more and more, so that the professionals get an appropriate and an accurate, and in turn we actually try to reach the best approachable heights. So for more such support, uh, thank you, sir. Over to you, Dr. Gopakumar sir.
Yeah.
Thank you.
So is Kapila then in?
Excuse me. Hello.
Kapila,
Hello.
Yeah.
Sir, somebody mic is on, so its voice is disturbed. Please, if somebody is admin, so please mute everyone, because I'm not able to hearing properly the panelist. Please.
Dr. Kapila is just about to join.
Okay.
Sir,
Okay.
Kapila is about
So,
to join us. Yeah.
all right. All right. So so Dr. Dev, this is where we are. I think you can just give you a few inputs by the time I think we can start. Hello.
Yeah, everyone. Good evening, everyone. So today we launched this information brochure. We started the program in association with the Armenia. As you can see here, it's a two program, international certificate in sports physiotherapy and medicine. So these two certificate we launch. We can see that Dr. David Katrian is a rector, is a vice chancellor of ASIPCS, which established in 1945. Angelia Nushikia, she's a vice rector of external affairs and strategy development. And we have Armine Sargassan, the head of the international cooperation and development. Ms. Lucien Stepian, she's a Dean of Faculty of Health Technology and Sports Tourism and Management. And we have Gavok Narbandyan, the Head of Chair of Physical Rehabilitation, Dr. Gopu. You can note the name of this fellow. And we have a Professor Tiger Peterson. He is a Tigran Peterson. He is also the speaker of the today webinar, speaking the sports medicine. And we have Anna Martiasan. She is with us on the physical rehabilitation and physical therapist in Wigmore Clinic. And our part, it's a Sports Academy Association of India from India, established with the principal, with the so many directors, vice chancellor, with the mission to create the placement and employment opportunity for youth of world, not only in India. So we are with this mission, and myself, you can see I'm a founder president of SPA India, and he's a vice president Gopal Arora with us. Now you can see Mrs. Renuka Sood, she's the director of SPA India, and Mrs. Kanika Chopra, she's also one of the directors of SPA India. We can see Dr. Akshat Pandey, we can see Dr. Oshin Sharma, and Dr. Khyati Sharma. So I need just a thumbs up by everyone. Today we launched this international Armenian joint venture online course on international certificate in sports physiotherapy and sports medicine program on 30th of June evening 6:30 time for India, and hope 5 o'clock evening in Armenia. So everyone can give the thumbs up. If anyone can see me, thumbs up on the screen so that we can celebrate. This is the opening of this information brochure of today, 30th of June.
Congratulations, sir.
Thank you so much, everyone. Everyone can be
Yeah,
put up.
congratulations the entire team of India and Armenia.
So nice of you. Everyone can put up the chat box also their wishes, which is very important for all of us. We all are on the mission to create a good sports person in worldwide. Thank you so much, Nilima ji. Thank you. So on chat box can mention, yeah, your wishes you can give on your chat box. Yeah. So then, yeah. So this is the opening of this. Now I take some moment to sharing the today's webinar, which we can start. Yeah. So Dr. Gopal.
I'm here.
Yeah. So now the stage for you. Mic is your. Let us give me some moment so I can share the poster of me and Dr. Tigran.
Yeah, sure.
Yes. So can you able to see the screen? Yeah. Yes, welcome. Professor Dr. Gopa Kumar, sports physiotherapist from India, and Professor Tigran and myself today. I'm taking care of the all things. So let us welcome Dr. Gopa Kumar. So share your views and what is the career opportunity and how the sports injury prevention and return to sports by the trainer, because we saw so many sports person, they leave their career in between once they get a very small injury, but due to they could not get appropriate treatment for them, then they have to or they forced to leave their career in between. Thanks to all physiotherapists, thanks to all sports medicine people. They do the some wonderful job for those sports person, and train them, and they come back on the track. So come back on the track with the help of you all people. So I wish to invite to Dr. Gopa Kumar. Let us share his all views and guidance to for all of us. Dr. Gopa Kumar.
Yeah, hi. Thanks, Dr. Dev, for bringing me in for this information to be passed on. Yes, as Dr. Dev said, the sports injury and sports injury management is a very important factor and important component played within all our teamwork. So it's a combined teamwork. So the team of professionals, starting from sports medicine specialist, the sports psychologist, physiologist, then physiotherapist, then we have SNC coaches, so and training coaches. So it's a combined teamwork which has to play a role in bringing a person back to his right, return to sport from the day one of injury. So it's not like one person, or it's not an individual or one to one. It's basically a whole teamwork. So uh, prognosis of a person and bringing them back to a right position to play is dependent or decided, or the decision making is by the whole team. It's not one. So that is what I have seen with my experience. So the whole decision making should be with the team. So these are the main important component. And we say today's sports in India, it's basically growing up, and it's going on in a what do you say? It's been it's much, it's much more, we can say it's much more what in demand, it's in demand. So when the demand is more, the kind of our role also plays more, because you can see when the demand of sport is more, the injuries are also more. So it's all different kind of sports which come in specific to it. And when we all play a role, that's the main part. We have to see that, analysis of the
Dr. Gopa, please unmute you.
is it okay
Yeah,
now?
yeah, fine. I mute all the participants.
Okay,
Yeah,
okay. So,
please.
so if you say today, we say in this pandemic situation, a lot of sports people in not only sports, even people who are fitness free, including us. When we are at home, and at the situation where we don't have a kind of activity, probably what we used to do. So especially in sports, you need that kind of intense activity. Their body has to be conditioned. They should be prepared for the next game. They should be prepared for the competition. So these things are all away from the right situation from what they are facing since past few months. So when in chaos days, you can see the people who are injured, people who have been managed with this reconstructive surgery, they are at home. They are also following a kind of treatment methods, recovery methods at home, just maintaining themselves. But what happens when they come back to the game, or what they come back to their right sport on the field or onto the court, right, specific to a kind of game? Now that's a challenging situation for us. That's a challenging situation for us, because the person has been at home from a long period of time. It's a prolonged break. And what do you do? What are the tips? What do you have to follow? These are the things which really consider these are the really which what is a triggers the kind of clients or the players who really want to get back as it is what they were before. So there'll be a lot of sportive players you can see, very high, intense sportive player. There are players who are now putting on weight, sitting at home. Yes, they do workouts, but if you say any kind of post-surgical, patients, what would you do? So now we have come with virtual, type of training, where at least we can do that, and we can maintain them one-to-one, face to face, through online, training them for a few methods. But that doesn't solve the issue. But at the same time, this is at least what we can do now to get them maintained through a training methods with the patients coming back next after the pandemic. They can get into an on field properly. But yes, so situation here is what we see. So this is basically, so that's why we have chosen the topic, sports injury prevention and return to sports after a prolonged break by me and Dr. Tigran, which we would deliver now with a few presentation with slides, which I will show you, and hope you will get benefited by the concerned presentation what I'm going to do. Right. So can I just go into my presentation? Is it okay? Dr. Dev, it's audible, right? I'll just get into my slides. All right. So it's basically the sports injury prevention and return to play tips after prolonged break. Yes. So when we say this, there are common sports injuries. I think most of the people would know, if you're into sports, if you're aware of the kind of conditions or injuries, you would know that what would be this injuries sport specific to any kind of sport, whether it is cricket, football, rugby, or badminton, long tennis, etc., etc. So you say the common sports injuries which you come across would be ankle sprain. Now, ankle sprain, yes, it's basically, again, if they are not warmed up properly, with your, so this can cause a lot of issues on stability. So ankle gets unstable, and then you have a repetitive. So sometimes it goes as a neglected part, and then once you neglect and again keep moving, it can also cause recurrent injury. So ankle sprain is a common one. Then you see a groin pull. So groin pull is common in football and any kind of sports like pro kabaddi or football. So American tackle football, or it's called as rugby. So these are the places where you find groin pull comes in. Hamstring strain, which is a common problem, which you see up. That's also a common sports injury. Shin splints. Then you get knee injury, which is common as ACL tear. And then we have the patellofemoral syndrome. This is very common because this is again a type of neglected issue, and it comes as repetitive. And tennis elbow, very common. So these are the when you come across common sports injuries, these are the ones you would get. Again, certain other injuries which are, but it is not as common as what we see now here in this. So common problems prior to return to sports. So when you say after long break, now you're getting in, what would be the issue in common clients? Even if it is, think we are in the same box. We are in the same box. It's not only a player, but at the same time, we as a normal person who goes to gym, who's gymming daily, running daily, doing all kind of activities, we are at home now, or we are at a break, long break. So what would be the problems which we face? Fear. Now, fear of, what is fear? In the sense, you get into the activity, do you have a confidence? You will not have a confidence of doing that kind of sports. Now, if I want to get something into an intense activity, I would think about if I am able to do that, or if I'm able to accommodate to that kind of activity there, or accommodate to the kind of coach or the trainer is going to give, or whether it's I'm able to take that weight kind of strength, even if it's a strength training amount of weights, whether I'm able to take those. So a fear is within you, which has to be solved. So that is one part. Then anxiety. Anxiety is another part which plays a role every now and then before getting into a game, right? And lack of motivation. That's again you surrounding, you are at a place, but you're not meeting people. You are going to get, after a long break, you're going to meet people, you're going to meet your colleagues, you're going to meet your friends, you'll meet your fellow players, all these. So again, you need to get your motivation, gained up before you do or you get into a sport. So how do you do that? That's another part. Lack of readiness. So again, are you ready for that? So you should be physically and mentally prepared for whatever activity you're going to do. So your lack of readiness is one thing which you could see, because that is another problem. And physical and physiological factors. So these are any kind of injuries which are healed, or whether it is healed, whether you're back, you're rehabilitated properly, you are undergone a training process properly, with which will not affect a physiological process or physical part of your area, physical area, where you need to be prepared, so that you are out of all this. So these are the few problems which you come across prior to return to sports. Now there is something known as injury prevention strategies. So these are all depends on each category there. So you say age, so age, and then some sports factors, and then the game situation. These are the important. So age is one factor which plays a role. Then gender. So at each age, you can say, now at the present situation, you can say from the youth till adults, they are away, they are from the activity, they are away from the activity. They need to get that right of kind of training process to be proper. Their body has to be accommodated to kind of training process, and then get back. So at whatever age, you need to go through, and you see. So age is one factor for that. If that is done, a proper training process done according to that age, then you are you can avoid the risk of injury with a proper with the proper training and proper instructions. Yeah, that is what we see. And then gender. So either male and female. So again, there are way changes. So you need to see that what kind of training process can be given for a male athlete, a female athlete, or these has to be noted down. Body composition, example, body weight, fat mass, anthropometry, BMI, body mass index. So alignment, joint, range of motion, flexibility, strength. These are all important factors, important part played a role. And then history of previous injury. These has to be known proper before that. The skill level, example, sports specific technique, postural stability. See, all these things, there are a lot of things which will get affected when you're away. You're on a prolonged break. All these are part of it which will get affected. Now you need to get all this solved and monitored, and then get back to the sport. Psychological factors like motivation, as we saw before, motivation, competitiveness, level of taking a risk. This will be more. So the risk of taking the level of taking a risk will be more. So you need to concentrate on that. Sports factors, example, coaching, referee rules. So now a coach is going to give you a training process. Now when you're coming back, they are going to give you a training process. Now whether you will be able to cope up with that, whether you will be having that. Suppose example, we are going to give you a kind of training process which needs high intensity interval training. So we are going to give you a lot high intensity. You're going to give a lot of endurance exercises. Whether you'll be able to cope up that, whether you'll be able to. So again, those times are the places where you start getting a lot of cramps. Your lactic acid gets collected. You get DOMS, that is delayed onset of muscle soreness. A lot of issues there. So you need to see up. You need to get that prior rectified, monitored, so that and educated to that particular player, that you may come across these. This is not a factor, because again they may be have a fear and anxiety would be there in part. Again, they would get into depression, that they are not able to perform. So every player would have their performance level checked, because they would feel that you're getting back, whether I'll be able to perform as what I was. So that is where now in this situation you could see after a long break. Environmental factors, example, playing surface. Again, your surface changes. You're at home for a long time. You're away from this. You're getting into that surface, artificial turf, artificial. You may move on to a mud or turf, or you're going to change the surface. So the surface change can also cause, and it plays a role in injury prevention. Maintenance properly, if it is done. Then weather, environment, your body has to get accommodated to that. Now if it is summer or winter, or the monsoon changes, you need to get accommodated to that. Example, equipment, example, the helmets or protective guards. So these. You need to see that all these protections have to be there, playing a role. Otherwise, you are, getting a risk of injury. So again, you need to use these equipments properly, specific to the concerned sport. Game situation is where you again, you say that the game is high intensity game or low intensity, or there are games which are competition, or it is not a competition, it's just a training situation. So see that situation and then you act accordingly. Opponent behavior. Yes, now you are facing some opponent. Now the opponent is bit more strong, you are not that strong to get in, so you need to see the opponent behavior, go according to that, so that you are able to just adjust to that initial phase of training and then get back. Don't try to compete, or don't try to go to the opponent in such a way that it's the same, because their whole training process would be different. Their body, as we said, all the initial part of its body composition, the body build, these are all maybe different. So you need to see the opponent behavior. And then the biomechanical alignment variations during movement. So posture, the posture alignment, because they are away from the long break, and you can see a lot of postural issues. So in this particular pandemic situation, when they are on the break, the first thing what we do is to give a lot of posture based exercises to the players, so that they keep up their kind of posture in the right way, and then they get into the field. So this helps them to at least monitor, and then the training process also becomes much more better. This is a schematic representation of injury risk process in sports. So this is what I've just shown. There is internal factors and there are external factors. So internal factors are whatever you have in your body, and then external factors are based on outside. So the environment, weather, all these comes into that. So if it is again a predisposed athlete, so you have three things in that. That is the injury prevention, the risk management, and periodization. Three things which are in a predisposed athlete. So which is again based on the two factors which is there. And again, this leads to a path of it. So based on that is the path of injury, or path of to exhaustion. So where we have to see three things, that is based on the risk management. Whatever risk we have seen, that is based on the risk analysis which we saw. The three things: the injury prevention, the risk management, and periodization, which is onto a suspected athlete, potential inciting event. So you see that all what we said, the factors which are onto a risk management, that comes into an internal and external factors that which can lead to a path to an injury. And this is where when they are not followed with that, the risk of injury is already there so it is already an injured athlete. So at a break, you need to follow this kind of schedule of risk management. That is again, what amount of strength you have to give them, what is that, especially on a strength training, and then the load management, what amount of load he has to use when he's going back to the sport, and the periodization, that is the kind of gaps what they should have between the activities. So seeing all this can be solved out in an injured athlete, because after coming to the sport, giving the same kind of training process, giving the same kind of intensity what they were doing before will not be useful, because they may get into a lot of problems and risk of injuries 80 to 90%. So you need to monitor, get them all assessed, analyzed with all this kind of problems, and then try to execute it in a right way. So when you say, periodization, so this is to design the athlete's workload. Again, whatever. So you have gaps. You have off season. You have usually any kind of activity, any kind of sport has got an off season and on. So here now the person is away at home. They are sitting at home. They are being away. So this is an usual part for him to at least come out. But again, the activity is not the same. You're not on field. You're not on the on field. You're off from that place. But at the same time, you have a time to at least work out on your body, especially on your posture, especially on your little bit of endurance activity, your core muscle training, all these things. So off season is basically a lower volume training with an increase in the intensity. But again, this off season can be considered as what you have now here. Workout on each muscle group individually, focus on each muscle group which has to work on, correct loads at correct times. So use the so load monitoring has to be, so this basically you're trying to use the load. Unwanted load may also cause a particular issue, and then that also is a risk of injury. If training is mismanaged, can lead to overtraining and injury. So again, when you are into an activity and if you are not being managed with proper way of training, this can lead to overtraining. So periodization plans ensure workload is enough to stimulate change and prepare for maximum performance without overloading. So workload should be distributed according to the season. So this is when you get into the activity. When you return to sport, after that your season starts. So based on that, your workload is managed and given. Load management is again the external risk factors and potential of inciting events. So all this is basically based on what we said: the artificial turf, the surface, everything comes into an external risk factors. Fatigue or negative physiological effects. So again, if you're having a burnout or if you're overloaded, so that also causes a negative physiological effect in your body. Fitness or positive physiological adaptation. So if you're not proper fit enough to enter into a kind of activity post this, that also affects. So see that load management is right in a right way. And training sessions are designed to elicit a physiological response in an athlete to enhance their performance. And therefore, the workload applied must be high enough to cause these physiological adaptations, as such as aerobic fitness, strength, endurance. So these things can be already worked on. If you're getting into an activity after a long break, prior to it, if you are starting, if you start working on an aerobic fitness and then strength, endurance, these things can be delivered at the when you are into a return to sport activity, because you are already working on your body. This in turn protects against any injury by ensuring the athlete is fully prepared and can withstand risk of external factors, making them more resilient to the potential inciting events. Strength training, as usual, whatever we do a lot of activities based on strength. So again, individual muscle groups can be taken up, and again you can do a lot of alternative methods at home or at your place where you are already away from a break or from the activity. You can use any kind of tools, any kind of things what you have as a part of a training program to make yourself or maintain yourself. The implementation of strength training programs significantly reduces sports injuries, with lowering acute injury rates by more than a third. So over injuries are more common, but if you try working out properly with an individual groups, it will really benefit. And that's where you see in strength, balance, plyometrics, agility exercises. This can be combined. You can use a combined or circuit way and do all these things, so that will help you improve your endurance and balance and coordination, example, etc. So plyometrics improve landing techniques and thus the knee position, ensuring current biomechanics and a reduction in joint strain. Again, if you're getting into a plyometric type of training after a long break, again, it's a lot of landing, lot of jumps is needed. Again, this shouldn't land up in any kind of sports injury. So you need to you need to learn a lot of jumping techniques, landing techniques. This can be done with the proper posture and biomechanics. Injury reduction appears the most successful with eccentric exercises. So anything, I think if everybody have heard on this term, eccentric strengthening. Eccentric strengthening is where you try more of force when you try moving away. Like you try, example, if I say I'm going to do a squat, so I do a slow squats, very slow squats, bending the knee, and then I push out with an extension, with moving the leg up. So this can be done with a repetitive. This is kind of eccentric. So this is a free body, but at the same time, you can have a lot of bands, tools for it, where you can use and try doing a lot of eccentric based exercise. Eccentric based exercise are very much useful in recovery, and it brings in a lot of good results. So here I've shown one example of, see, there is a player, is a competitive, player, is an elite player who plays, and he's been injured with an ACL, and he's been at home for a long break. Basically his history shows that he's undergone an ACL reconstruction in the month of March. So now it is almost 3-4 months, which has already gone off, and from the time of pandemic, he started with his gradual rehabilitation, and then little bit of training which was started up, but after that a long break, and he's away from this. At the same time, I with a virtual based training, I started maintaining him so that he gets prepared and he's mentally prepared, his fear goes off, his anxiety gets off, and managed to bring him at least to a stage where is much better. So with a follow-up with a concerned specialty orthopedic surgeon, as of now, it says that he is much better than what he was. So it is basically how we are monitored and how we have instructed and how we goes with the face-to-face training. So here's one of the exercise which I'm going to show, that is basically for his hamstrings, because when you go with an ACL reconstruction, his hamstrings is a very important part where you have to play a role when extension, and trying to get that hamstring strengthened is where I'm using an eccentric kind of, or Nordic way, eccentric training. So this is not a Nordic hamstrings curl. So it is known as Nordic hamstrings curls. Here, usually, if it is in a gym, or if it is in a on-field area, what we do is the physio or the SNC coaches, they hold on his particular legs and fixes it up, and then he does. So here I'm doing an alternative method for him to get trained at home, where he fixes his legs within the couch, and then he starts putting a pillow for his support on the knee, and he does it so that at a minimal thing can be gained for him. So this is a way how we are doing it. It's a Nordic hamstring curls. Right. The next is I'm focusing on soleus muscle, the soleus again muscle activation. Initially without any work. So earlier when he started up, he couldn't even stand with one single leg. So single leg standing with a weight dumbbells on his hand. He started doing his soleus muscle activation. Again, posture correction here. Everything is being managed, and he started performing well. So these are all prior to a pre-landing process training. So we start asking him to jump and minimal heights, and get that phase of plyometrics also with him, so that tomorrow he's going to reach up the ground. There is no problem with him, because he has already come across his body is accommodated to this kind of training. Here are a few exercises. Basically, now again, I'm focusing more of the quads and I think. Hello. Hello. Hello.
Yes.
Is it clear?
Yes.
Yeah, there was
Papa.
some disturbance. I think I was getting some other call.
Yeah.
Hello. Yeah.
Who received a call?
Okay. Is it okay? Is it clear? Is it audible?
Yes. Yes.
Okay. So here we go with quads and a bit of quads exercise here, and concentrating on his bit of I'm putting the load. So now I'm trying to use the load monitoring part. Here I'm trying to use much of load to get him a pace, so that he starts working on both the legs. Yeah. A bit of coordination of his movement pattern. I'm just analyzing his movement pattern, because so that he gets this fast initially with a bit of thera loops applied, and a kind of walking diagonally. So this is again, I'm changing the directions. So he gets a kind of feel within his knee. It's a minimal phase of trying him to get so that tomorrow he gets into the ground, he moves around, he changes directions. So this is a kind of training process again. So getting used to it. Yeah, this is what I have already shown up. So return to training and competing after a long break can be anxious experience, as I said earlier. So what are the challenges before resuming the sport? So these are the challenges. So this can vary from person to person, and is dependent on multitude of the factors, such as personality of the athlete, the type of injury sustained, and the physiological and physical trauma which when occurred. So usually experiencing anxiety is unpleasant and may result in athletes focusing on negative what such as, because most of the player, if you see your experience practically, you could see that a lot of people who have undergone a surgery or who have not undergone a surgery, who are injured, and this, if you see those have finished off their surgery and they are in a break, these are the people you will see that they are very anxious, and they're kind of they get depressed. At the same time, injured and they are into an activity, of course they do have, but there are a few percentage difference. But overall, if you say the negative part is what they will have. What if I break down again? What if I can't come back to my previous level of performance? What if I get a compensation injury? This is again a question, because They play, they say that if I'm going to get the injury in another leg because I'm going to use more of that, I'm going to put more of force on the other side. So what if I go through another lengthy rehabilitation again? So they have come across a major rehabilitation process, and again, going back to the same process, they would understand because they have already experienced it. So these are the challenges which are faced, and this is how you can be motivating the person. So everything depends on mental readiness. So we have to play as a teamwork for starting. This is what I said from start. It starts from the exact specialist, whether it is orthopedic surgeon, it is sports medicine specialist, it is a physiotherapist, it is an exercise physiologist, or as SNC coach, or the coach, training coach. Everyone plays a role here because everyone's words has to be the same way, because that is where you're motivating them and getting them the whole confidence. And each player, each team has to play their own role in a proper way, which I think the result would be 100% in bringing the player back to his normal condition. So these kind of questions will not arise, because this is where they arise, because they could see now, as nowadays social media is also there. They keep onto the YouTube, they move around there, they see that this is problem. If this problem is able to be managed, how do I do this exercise? They try doing those exercises. So these are all a major impact played a role. So we have to see that, how we train the person, how we deliver the person in a right way, and keep changing variations when you do the exercises. Doing the same exercise also will is bored with a kind of player. So in the point of rehabilitation, or in the point of functional training, or the return to sport training, whatever it is, variations have to be keep changing for them. The physical and psychological strategies, that is basically the important part. Identifying pain-free exercises, then you make a plan, making a plan, maintaining strength and conditioning, and not fearing intensity. Because if all the three are played a major role, then your part is not to fear any kind of intensity. Use intensity and don't push yourself, don't get exerted. So injury psychological readiness to return to sports scale. So this can be again a part played in a person who's going to get into sports after a long break. He's doing all this. Try to give them this kind of sheet as a scoring sheet, which can be noted down. And with this particular scale, you could understand where the person stands, and then try to manage, bring them, monitor, give him the maximum confidence in what the sport you're going to play. And it also educates a person that, okay, he is at this stage, and yes, I should only go with this kind of intensity at this particular, based on the scale what he has achieved, right, or the score which is achieved. So here the questions which with the main part is each question is basically with the kind of score which is no confidence in my return to sport, moderate confidence, and complete confidence. So this is basically scored with 0, 50, 100. So the questions arise, my overall confidence to play my sport is, whether it is no, whether it is moderate, whether it is complete. Again, to play my sport without any pain. Then my confidence to play, to give 100% effort. Then about thinking about injury when playing us. So not to think. Then my confidence is injured part of my body is able to handle the demands. My confidence, my skill level is so and so. So how is the skill? What is your skill? So whether it is full, my confidence is full, so it is 50. So you're just telling about your skill, whether you are confident on that. So when you see a rating of these skills totally, if you have scored up much better with 80 to 90%, that means you are eligible as a return to sport player. Okay, so but at the same time, if you are achieving with less than 50% or 40%, again you need to work on the area where exactly he is feeling much better. So you understood from the score here, or the scale, or the whole scoring sheet, what we have seen, and then based on this act in a train, bring them confidence and get them back. So this helps in education. The precursors of psychological readiness. So there are 4 things which are this. So basically the psychological readiness, which we already discussed. Confidence in returning to sport. These are the major, again, plays a role in their mind. The previous performance standards and realistic expectations. These are all a part of psychological readiness to the sport. Confidence in returning to sport. So first thing is that. So this is what we have seen. The psychological part played before getting into sport is based on 3 important things. That's confidence, then the previous performance standards, and realistic expectations. Confidence is what? That's basically the trusting the the medical team, your social support from physios, coaches, medical specialties, achievements of physical standards during rehabilitation. So first you should have the confidence. Second thing, when you're saying the previous standards, whatever physical standards, in the sense you may have undergone a particular treatment methods in that rehabilitation process. If you have done that, and if it is same as we said, if the variations, if the treatment is, they get bored. Again, that is the part played later when they get injured and they feel that they have to come back to the same rehabilitation process. So this all problems which affect the psychological readiness towards that sport. So see that they maintain the balance that, and then they get achieved from the kind of physios or the support coaches. Then realistic expectations, that is basically again not to be disappointed and stick to the time frame. In the sense, even if your instruction is given that okay, you may take 3 months, you may take 2 months, you may take 1 month, it is basically instruction based on whatever is been criteria has been seen, based on your assessment, based on what they have analyzed, based on the score you have given or the player has given. Based on that is what they have decided. So there is a time frame. So stick on to the time frame, especially previous performance standards. That what we have seen is, again, as I said, you may be the player may be performing very well in the earlier stages, and after a long break, they're coming back to the ground. So they can't expect the same thing what even if they expect, even if they try to push themselves, it is better to go with a proper analyze the problem, assess the problem, whatever, give the scoring sheet, find out what is the score, what is the scale, what he has brought out, and then train them and educate them. That's the main part. Educate them that whatever previous performance that can be already brought out, but there is a proper protocol. Effective goal setting, then you set your goal completely for him, what he has to achieve and where he has to achieve. Whether it is a sprinter, whether it is a runner, whether it is a cricket player, whether it's a football player, what is his position, what he has to play, and how he has to go out with that kind of intensity, everything can be set. Avoid repetition of exercise. This is as what I said, whatever you're training, see that you keep changing because their body has to get accommodated. And group training or rehab, yes, once after this pandemic is over and when you're back to the return to you give them a kind of group rehab so that everyone gets into and they get more motivation. So level of motivation also increases. So, get motivated much more in performing. So their performance, everything has got an impact on that. So whatever you get, these or have direct contact with the performance part. So get yourselves ready psychologically, physically, and mentally. And at the same time, this will help you in performance enhancement. A summary of overall as an instruction, that is when you get into a return to sport after long break, that is wear the proper protective gear, warm up prior to engaging in any sports, that's a must. Drink a lot of fluids, right? So, and learn the proper techniques and master them, what has been taught to you by a concerned specialist. Make getting plenty of sleep, which will not be there because of this particular situation. A lot of people, their sleep issues have been there. Their proper sleep is not there, which affects an activity. So again, they have to get into that time frame. So getting plenty of sleep. Don't try to play through pain or an injury. If you have that, focus on it. Try to rehabilitate. Try to elevate that pain through various tasks. Take periodic breaks. Drink plenty of fluids. Get your body conditioned. Go online and keep in touch with your training coach or physios about your present condition to get prepared. So that's what we are doing now and what we have seen. Take the anxiety and stress out. Get yourself mentally prepared, physically prepared. Get yourself mentally prepared. This is what we have already told. So if these things are being taken into a consideration prior to a sport, I think overall, their performance is going to get better, and they would, reach the standards of what they were, right? Thank you. Thank you for your attention. If there is any doubts
wonderful.
here.
Yeah, wonderful, Dr. Gopa.
Thank you.
Participants are waiting for their certificates. So I will reduce my time. My time was 20 minutes. I just take a 5 minute, and rest of time I will give to Professor Tigran from Armenia. Welcome, Dr. Rajkumar Sharma. Just see your WhatsApp. I send you some message. Yeah. Yes. So here it's a fantastic session for from Dr. Gopa.
Thank
Here
you.
I wish to talk
Thank you.
something for the SPAA India and the Armenia. That's SPA India take initiate to create the sports environment and especially create the employability in a sports management. So that we started to creating the environment. How we start to create the environment? We start to organize the sports fair in a Pragati Maidan, New Delhi. Some of people you knows that Pragati Maidan is an international renowned place in India. Not only in India but also in entire in the world. So there we invite so many people, so many industry from different background, sports infrastructure industry from France, from China, from New Zealand, Australia, and some of the company came from Japan also. They bring their very different kind of grass which they can use as a like a carpet, very soft carpet. So many things we introduced there in the sports fair of Pragati Maidan, when we organize the sports physiotherapy conference, sports medicine, fitness manager, fitness coach, some bodybuilding competition, and many plenty of things. Even in a sports fashion show we organize there, some Zumba kind of things we organize there. So at least 3 days continue that every person who attached by heart physically with the sports, they enjoyed that all. And we developed this employable education program for the world, not only for India. And I'm using one more term, economical, because once we use term economical, it means it is suitable for the volume of the people. After these program, they can get the respectable bread and butter. I use term respectable bread and butter. We all are those are the 40 plus of age. We can see our young friends, boy or girl, they start playing in 1991, and after 10 year, 20 year, they if they are not able to bring the medal, now they are suffering for unemployment, which is the biggest challenge for Indian youth and youth of the world. And we all together, we create the employment opportunity for them. We give them the short-term certificate program in a sports management, sports marketing, sports law and journalism, sports physiotherapy, sports nutrition, and with the help of Professor Tigran, sports medicine. Then the plenty of things we organize. So I stop myself here. Then 7:45, Professor Tigran, we're going to start the convocation. So now over to Professor Tigran for the health benefit for sports medicine in a sports. Welcome, Dr. Tigran Peterson from Armenia. Yeah. So now you unmute.
Thank you.
Yeah.
Yes, thank you.
Welcome.
Thank you. I will share a presentation. Fortunately, today's topic is really very large. Unfortunately, Dr. Kopa Kumar spoke about the majority of the aspects that I was going to discuss. And here on my presentation, you will see mostly a focus on the sports medicine activities and how the sports medicine deals with the injury prevention and the programs of the injury prevention. Because, you know, whenever we work with the athletes, this could be a very small group of professionals, or this could be a national team, or this could be a very large squad of athletes that you are working with. And as Doctor mentioned, we are a group of professionals who work together, and we have certain goals to reach and to ensure proper and continuous performance of athletes. The injury prevention is kind of a very extensive, it's a multi-step process, and here it requires certain planning from the team of the professionals, and it requires the participation of different professionals, including the doctor and also the physical therapist, the athletic trainer, nurse, psychologist, and the whole team. So how to prevent the injuries in general? Maybe you are working with a large group of athletes and you are the head of the group who is responsible for the prevention of the injuries. In medicine, there is a term which we call the screening process. And in general, the screening is a procedure when doctors use different type of tests, like laboratory tests, or this could be a diagnostic procedure, or even a questionnaire, which I'm going to talk now. So you use these tools to identify any issues that the healthy individuals have. So the screening tests actually are not for the patients, but they are for the healthy individuals who might have this or that problem. So first of all, the prevention process, the prevention of the injury in the sports, it starts from the screening process. And what we can use for the screening process, how we can identify these problems in the athletes, first of all, we can use different type of physical activity tests, functional assessment, and questionnaires. So all of these are in the arsenal for the evaluation of athletes and for the estimation of the possible risk for injury. What is my intention now is to speak about the screening process, and I want to speak a little bit about the questionnaires and about the surveys that you can use these questionnaires in your group of athletes, because sometimes you have a very short time, and you need to reveal the problems that are in the group of athletes, and you need the fast information about the condition in your team. So you can use a variety of standardized tools, which are the questionnaires. For example, on your screens, you can see the extended Nordic musculoskeletal questionnaire, which is, I said it's standardized because it has undergone extensive testing in variety of clinical trials, and it has undergone testing for the validity, reliability, and also for the repeatability. So you, as a professional who is working with the team, can use this questionnaire to assess the whole group for some injuries that potentially the athletes may have. So sometimes I should say that the professionals, the doctors, the physical therapists, even the coaches, they neglect, so kind of they underestimate the role of this screening process. But again, I want to mention that there are certain advantages for the screening process, because mostly you have a very short time, you need to perform the screening, and you need to identify a large group of identify the potential problems. And I should say that this screening process should be conducted by a very experienced professional. So even there is some research and the paper published which indicates that whenever this questionnaire is used, or the testing is applied by a non-professional, let's say one of the athletes can perform this testing, like filling in questionnaires with the peers, but whenever this is done by a professional, it increases the efficacy for 20%. So you can find more than 20% risk for injury whenever this assessment is performed by a professional. See that the last paragraph in these slides indicates that not only the musculoskeletal assessment is important, because Dr. Gopakumar also mentioned in a detailed manner about the importance of the psychological assessment. And you see here another standardized tool, which is the Orebro musculoskeletal pain screening questionnaire, and has been used in research to look potential problems, and particularly the subject's pain avoidance. So whenever you have all this data collected with your questionnaire and you work with a large group of athletes, you can use computer software, so you can register your data, you put your data into this computer, and you find specific points, specific issues that your athlete has. And these questionnaires, they have certain battery of questions, group of questions that may identify the potential problems, and they can serve as a potential predictors to identify those potential problems that your athlete may have in the course of the season. The first battery of these predicting factors are, of course, the function group questions, and they mostly focus on how the athletes perceive the injury affected them and their ability to perform. So this is the first group of the questions. And the second, of course, you can guess, it should be the pain factor. So the functional performance, then the pain factor, and you see that the last factor, the final factor, which is a predictor, is the fear avoidance. So all the same, the psychological factor I was talking before this. Now the functional assessment. So what we do with all this data, okay, you have this data in your computer and you know that this athlete or that athlete has certain issues and you need to perform a further examination with the functional tests. And luckily, Dr. Kumar spoke about different subtypes and different categories of the functional assessment. And you know, the functional assessment strategies are very different, and you can use different techniques to use to test the muscle strength, to test the range of motion, to test the possible injury. And also today, my intention is not to speak only about these functional tests, but about those methods which are currently used. First of all, about the isokinetic testing. Of course, if you have the opportunity to, if you have in your possession the isokinetic testing tools, or if you have in your possession an electromyography, or if you have a motion capture system, this, of course, makes more powerful the arsenal that you can use for the further evaluation of your athletes and for the finding of the potential problem that the athlete may have. So the isokinetic evaluation, it provides the examination, it provides us with information about strength, the muscle strength, and if like isokinetic testing at 60, 180, and 300 degrees can help accurately establish the ratios between the muscle force. Like, you know, for the perfectly that the muscle disbalance of force, like in hamstrings and extensors of the knee. So this muscle disbalance may lead to the anterior cruciate ligament injury. So if you are trying to estimate the risk, or whether to check whether there is a risk for the ACL injury, the isokinetic testing is a perfect tool for that. But that's kind of something expensive equipment that not all the clubs, maybe the allied athlete clubs or national teams, may have this equipment. But you know, the nowadays technology has changed, and other than the first line functional anatomical testing, also this type of methods are extremely useful. But we don't have to underestimate the usefulness of the simple musculoskeletal testing, because these are the first line procedures that the physical therapists and the doctors perform before the athletes is redirected to the clinic to check with the isokinetic testing or other tools. And isokinetic testing is a simplest method which can evaluate the power output of movements associated with the sport played and compare these against the competitive requirements. So you know what are the demands of the sport played by the athletes, so you can evaluate the athlete, the strength of the muscles, and this, of course, predicts whether the athlete will have a risk of injury during the season or not. And it has been found to offer about 10% reduction in injuries. Well, I will skip some part of the presentation here. Again, you see the battery of the tests used. I will not speak about a simple gait, arms, legs, spine test, which is widely used and is the first line method to perform the testing. But I want to focus your attention on the assessment of the athlete's gait. And there's a question why we need to assess, for example, the gait of an athlete. Because the rehabilitation process aims to restore the function, restore the range of motion, restore the strength, restore the agility, and now the gait. You know, there are different methods, and the most developed ones are the current 3D motion capture systems. At our institution, for example, we use the Quelsys system, which provides the 3D model of the gait, and or the Viking system, which is used in Wigmore clinics. So all of these are working with athletes. So why to evaluate the gait? Of course, you can use here in my presentation, I also show that sometimes we can use a 2D registration of the move of the gait, and there are a variety of softwares that allow you to analyze the gait using just deregistration of the athlete. So even I have seen, a variety of different publications in a very high-ranked sports medicine journals where the authors have used not the expensive 3D analysis systems, but they have used the 2D analysis systems. And fortunately, anyway, the gold standard for the analysis is the 3D system of the motion capture. So why to analyze the gait? Why to analyze the biomechanical data? We need to understand the exact forces which can be measured and the directions. So a picture of how much of an impact the gait abnormality will have on the athlete can be drawn up. The biomechanical approach can be used in conjunction with functional assessment to add detail and identify the extent of an identified problem. So the main issue here with the gait analysis is we do not know. Okay, the gait is restored. The gait is restored, but still, sometimes the motion capture system is equipped also with myography, which registers not only the biomechanical data, the angles, but also the muscle activity. So, what is my point? You see the normal gait pattern, but whenever you check the muscle activity, you see that the movement pattern is correct, but the movement is performed by the not correct muscle. So the adjacent muscles are performing the gait pattern, and the muscle which was injured is still not active, is not properly active. And this is why I again mentioned the importance of the current modern methods of the 3D analysis and myography, which could be used in the screening process and in the assessment process to perform the injuries. So the question is, will this altered activity of muscle eventually lead to any injury? Because the gait is normal. The adjacent muscles and soft tissues, they kind of compensate the movement pattern. Yes, this may alter the technique, and eventually this may lead to any issues or pathology in the adjacent tissues. Okay, so I want to also speak about some, here again, about the tests which are used, and I want to skip this part because, again, I think Dr. Gopakumar perfectly described the procedures, how the athletes are tested. Here are given some examples, or the modified Thomas test, which can be used to assess hip abduction, range, and hip extension, the combined elevation test, the bridging hold, which assesses the gluteal musculature endurance, the calf heel rise, and ankle dorsiflexion. And the muscular isometric ability of certain parts of the body is also measured to give an insight into not only the power, but the endurance of certain muscle groups of the athlete. Here, just briefly, I want to introduce that all this data which you accumulate, in which you can register in your computer after the screening process, after the evaluation process, after the functional assessment, after using all these type of technologies, visualization tools, including the ultrasound, diagnostic procedures, motion capture, myography, because, you know, this assessment tool after the screening, of course, it is followed by a very complicated procedures like the diagnostic measures and also the registration methods by the infrared cameras or myography. And one point which also Dr. Gopakumar touched in his presentation is very important. That's the periodization issue. That's the periodization issue, and because mostly we speak about the screening process and when should the screening process be conducted. This mostly can be an off-season period when there are no any activities. All the same, the recuperation period. But it's also very different for different sports. If we speak, for example, about a football, then the competition period could be approximately 9 months, depending on the country, of course. But in boxing, for example, the athletes may have 3-4 peaks, so the competition period is now multiple. So it depends, of course, on the sport, and it's really desirable to plan the way that the screening process, the identification of potential issues in your team is conducted in recuperation period. Then also for the rehabilitation, what is interesting, the prevention versus the rehabilitation, I should say that we can draw parallels here, and variety of methods used, all the same screening methods, evaluation methods, and also the testing. They are used not only for the preventive assessment, but also for the rehabilitation process and for the secondary assessment. And the understanding of periodization is essential for complete and effective rehabilitation. And this applies both to the phases of progression through rehabilitation, but also to an understanding of the training year of the particular sport to which the athlete is returning. Now, I will also, rather than the screening, rather than the prevention and assessment of athletes, the screening of the athletes, because really there was a very important and perfect point about pandemic situation, and that a lot of teams and a lot of athlete groups are forced to have a prolonged break, not only because of injury. This leads to a variety of issues related to rehabilitation and prehabilitation. So in terms of progressive systemic functional rehabilitation, we use also all the same methods, very similar methods. You see here underlined the scenes and SOAP technologies assessing when there is the injury, what we do. I mean, not the acute injury, but now it's time for the rehabilitation. The athlete has undergone a surgery or he was properly treated in a clinic, so it's time for the rehabilitation process. And we need to assess the injury, the severity, irritability, nature, and stage of the injury, and also the subjective, objective assessment and planning of the rehabilitation. And very briefly about the rehabilitation and some points that I would like to focus on, because I, to be honest, didn't know about the topic that Dr. Kumar was going to speak about. But anyway, the flexibility, restoration of muscle strength and endurance, and enhancing the proprioceptive control are the main concepts which are in the basis of the functional rehabilitation, progressive systemic functional rehabilitation. One point I would like to speak is the inflammation and pain management, because any athlete after injury or even a surgical process, he undergoes a long recovery, and sometimes there is an issue regarding the use of the ice packs or cold during the injury. I should say that the intermittent application of ice, it may enhance the therapeutic effect and relieve the issues after acute soft injury. And even, you know, that for the management of the acute injury, we have the principle of the price, which means the protection, rise, ice, compression, and elevation. So why I mentioned this, because it is much better, and there are some papers published, you see here the reference on that paper, that it is much better to prescribe the protocol, which is the following 10 minutes of ice water submersion, and then 10 minutes of room temperature, followed by 10 minutes of ice water submersion. And why is this important? Because this submersion may help also with the increased pressure, and in turn it mimics the compression effect. And it is estimated that early cryotherapy uses within the management of injury, and it, of course, makes it more effective. Then, in general, speaking in general, because I don't want to repeat the information that doctor presented before me, So what we need for the in the rehabilitation process, that's the restoration of range of motion and flexibility. And for this purpose, we can use a variety of tools and techniques. And you see that the joint range of motion could be, for example, for this purpose, you can use the static stretching and proprioceptive neuromuscular facilitation, and also the self-myofascial release. And I don't want to stop on these are very simple techniques widely used, and I'm sure all of you have, know about them, but they are the principles which are unaltered by the time, and they are used everywhere, all over the world, and there is certain estimated physiological mechanism and efficacy of these methods. All the same for the static stretching, which applies to autogenic inhibition of the neurons, and here you see that it is recommended duration of the stretching. Then I can speak about the proprioceptive neuromuscular facilitation, and two methods applied, the contract relax and contract relax antagonist techniques. Why is this important? You can increase the joint flexibility. You can increase the range of motion in the joint applying these techniques, particularly the last one, the relax antagonist contact techniques. And finally, the last one is the self-myofascial release, which is performed by slowly applying the force with the use of a roller on tender spots, which are called also the trigger points. Important aspect in rehabilitation is the proprioception neuromuscular control, which is very important for the athletic performance and biomechanical stability. And it is used, the training is used in the recovery process, and the doctor mentioned about a very good description about the plyometric exercises. So before reaching to that point, we need to strengthen also, not to repeat all this information, but again, in my opinion, the most important thing is to increase the proprioceptive influence on the joint and apply the static proprioceptive development, and then only when we are finished with the static proprioceptive, we can proceed with the dynamic proprioceptive training. And the assessment which you can perform to check the stability are simple tests, all the same Romberg test, or others more complicated tests are available that you can check, but I think the Romberg or the Stork stand are the most simple ones that are widely used. Here you see a table with a variety of tests. And as I said, the increase in proprioceptive awareness is very important, and the appropriate progression during neuromuscular control training will is responsible and will lead to progress in the rehabilitation, and now prepare the athlete for the effective plyometric training. Because without this proprioceptive increase in proprioceptive awareness, starting with the static exercises, then with dynamic proprioceptive exercises, so we need to prepare the athlete for the plyometric exercises. Okay, I don't want to speak about, also Dr. spoke about the ACL injury, and I have the same topic here with me. And also here you see the importance of unstable surface training, which has been shown to be beneficial in enhancing proprioceptive input, but also interesting data about this unstable surface training, because a very simple method, a very widely used method to increase the proprioceptive awareness. But I'm sorry, you think now that research data indicates that sometimes the training on a stable surface could have the same efficacy like the training on an unstable surface. It depends on the timing, when you need this training, when you perform this training. So like, for example, for sprinting assessments, the stable group showed greater advances, the group which was exercising on a stable surface, than in performance in contrast to a stable training group. So it depends, of course, what is your goal? What are you trying to reach? And Particularly in later stages of training, this unstable surface training may not be so effective. And about the strength and endurance training, also there was information about starting from isometric training, then very uh, very detailed information was presented by Dr. for the eccentric and concentric exercises applied for the joints, and this all, of course, the strength training, it leads to plyometric training. So why we increase the strength, why we perform, the way we increase the proprioceptive awareness, we prepare the athlete for the plyometric training. Like, for example, majority, if you analyze some injuries like anterior cruciate ligament, what causes the injury of the ligament? That's mostly the cutting maneuvers or landing maneuvers. So these are severe, the quick eccentric muscle contractions, which may lead to the damage of the ligaments. So this is why the plyometric training, which is the eventual goal or eventual process, the last stage of the training, this is prepared, or this is preceded by the strength training and proprioceptive training to feel more safe in the area of the plyometric training, to be safe of injuries and to prepare the athlete, because our tasks are completely different. And when you perform a simple rehabilitation process for an individual who is not an athlete, and you perform the rehabilitation after the ACL surgery, your tasks are completely different. For an athlete, you have to foresee all the same quick eccentric muscle contractions that the athlete may perform on the field. And this is why we need an extensive plyometric training program to prevent this injury again. Well, and I want to finish with this note, and again, that's for the rehabilitation, just to summarize again, evaluating the injury, then assessing the range of motion and proprioception, the strength endurance training, proprioception training, maximal strength, and only after comes the plyometric training. And then, of course, there is the role for the athletic trainer and the coach for the sport-specific development and performance enhancement. Thank you. I tried to present the main principles of the screening and main principle of assessment for the injury prevention. And I tried to give the highlights, and I think our notes mostly overlapped with Dr. Gopakumar's presentation. Thank you.
Yeah, it's a great insight given by Professor Tigran. We thank you. We all are grateful to you to give your precious time. We have a Dr. Pratibha Mishra with us from Mumbai, Dr. Payal Shevani from Dubai. So Dubai and Mumbai both are with us, and Dr. Rajkumar Sharma, he is from Jaipur. So we have with the very dignified dignitaries with all of us, and today is again the world's second digital convocation. This is the world's second digital convocation, because before this, none of the university, none of the school able to organize it. Hi, welcome, Dr. Kapila. Hey, give you a good smile. Dr. Kapila, can you hear us? Yeah. So here, this is SPAA India means start smile, share smile. So happy, healthy, Khelega India, Khelega India. It is a punchline for all of us. Now, the very important time in the life of each and everyone, might be you and me also, when we got our PhD degree in a convocation, or we celebrate the graduate ceremony for the 3-year-old boys and girls in our school. So enjoyment is the same, either we are a 3-year-old or either we are a 100-year-old. So time comes for the convocation without delaying, because we follow the 45, we will start it. So then this thing I want privilege from all of you. That is, I start the name of first successful participant. Hi Anna, how are you? Hello Anna, good to see you all. Himanshu Tiwari, great man. Yeah. So I think Dr. Gopa, all our participants are with us. Yes, Dr. Gopa, please confirm me so that I can take their name. And rest of our guests, you can take the name as shared certificate with you also and give them a shower of blessing from all of you because it's a very important part. So Dr. Gopa, I took only one name. So I start to maintain the protocol. My name is Dr. Dev. So I wish to congratulate the first participant. She get a successful certificate. Her name is Devika R. So can we see Devika R? You can understand that my name is Devendra Kumar and I started the name of Devika R. Yeah, hi Devika, how are you? Yes, good to see your big smile. So Devika R is the first participant. So Dr. Gopa, I hope you share the certificate with. That's Dr. Pratibha giving the double thumbs up. Dar ke aage jeet hai from Mumbai. Huh? Yes, congratulations Devika. Yes, yes. Yes, Devika. How are you? Congratulations. Say something. Devika Ravindra. Congratulations, you are a first person of the second digital convocation. Hello? Yeah. Yes, Devika. Would you like to speak something?
Yes.
Yeah, please.
Sir, it was
Welcome.
mute till now. I was trying. Okay, thank you so much, sir.
Yes. Yeah. So I unmuted all are on the video. Yeah, Devika.
It was my pleasure attending this certification program that under Gopakumar sir. Like he's really very good with the knowledge and all. Everyone know about that. And
Yeah.
I hope I've gained a lot more knowledge and I'll be implementing it soon.
That's good. We have Anuradha Verma with us from Jammu. Anuradha ji, can we see you? Dr. Kanika is with us also. She is an expert of sports nutrition and diet management. So now come on the video so that I can recognize and calls you. So let us start the second certificate from UAE, Dr. Payal Shivani. She was the first witness of first convocation also. Most welcome, Dr. Payal Shivani. So just announce the name of two participants. Yeah, please. Yeah, I will. Just do that. Yeah.
Okay, proud to announce the certificate goes to Dr. Ruchika Pal. Hearty
Dr. Ruchika
congratulations.
Pal, can we see you? Yes, would you like to say something? Yeah, Ruchika is here.
Congratulations, Dr. Ruchika.
Thank you
Yes.
so much, sir, and thank you so much, ma'am. And I'm feeling very proud that I am a part of this webinar and I am part of this certification course. Thank you, Gopa sir, for teaching us.
Yeah, Anushka, just
Thank you so
unmute your mic. Everyone, those are on video, unmute your mic. I unmute everyone. Yes, next number 2, madam, Dr. Payal.
Yeah, the second certification, proudly to announce the name is Dr. Manish A.
Manish A, please.
Dr. Manish A.
Come with the video, Dr. Manish. Yeah, Manish Acharya, how are you? Yes. Manish Acharya, say something. Unmute yourself. Fine, sir. Okay. So, would you like to say? Yeah, Manish.
Thank you, sir. Thank you so much.
So nice. Yeah, now I wish to invite Dr. Rajkumar Sharma ji. Please announce the name. Yes, please announce the name. Rajkumar Sharma ji. Unmute yourself, sir. Mute. Yeah.
Yes, I am Rajkumar Sharma and I feel proud to announce the name of Ansha Prabhakaran and congratulations to Ansa for getting the certification and lot of blessings. God bless.
Yeah, who is speaking? Yeah, Dr. Pratibha.
Dev sir,
Yes, yes, Dr.
I
Pratibha.
feel we should mute everyone, only
Okay.
the awardee and the announcer, if otherwise it will be
Yes.
too much of chaotic.
Yes, yes.
That's my suggestion.
I'm agree. No, I'm agree with you. I try to do something with the music of choice and toys. So, but
That will do end of the day. Like
yeah, end
just
of the convocation. Okay,
yeah.
right. This one.
We'll
That's
clap
idea.
for
Good idea.
everyone.
Good idea. So now it's a terms come. Dr. Pratibha Mishra, please announce the name to successful candidate.
Yeah, thank you, sir. Thank you, Dev, sir, our president, Sports Academy Association of India. It's my immense pleasure to present the certificate to the awardees. And the awardees are Dr. Merlin Matthew has completed the requirements and has been awarded the certificate in ACL rehabilitation and return to sports too. Congratulations, Dr. Merlin. I would like to see you with a smiley face.
Yeah, that's good. That's good.
Hello,
That's
sir.
So I want
Hello,
my
ma'am.
awardees to be smiley. Yes.
Yes,
Good
great,
evening,
great.
sir. Good evening, ma'am. And
Good
thanks a lot,
evening, good
Gopa,
evening.
sir.
Congratulations. Congratulations.
Thank you, thank you, thanks a lot. And my heartily, I'm very happy because Gopa, I have met previously also Gopa sir, and his session was so fruitful and so interesting. And certainly, I will implement it practically. Thank you, sir. Thanks a lot, sir.
So nice, so nice. Great.
Now,
Yes.
I take immense pleasure to announce the next awardee. Adhiri Prasad Maitri has completed the requirements and has been awarded the certificate in ACL rehabilitation and return to sports too. Congratulations, Adhiri. Please, can I see you with a smile?
Yes, yes. Yes. Yeah. So she's not here.
No worries, but still we cheer up for her.
Yeah, definitely.
Yeah, Dr. Dev Adri,
Congratulations.
Dr. Dev Adri is not there. Adri is
Okay,
not
no
there.
issue.
He's
So
not
on
coming.
behalf of Adri, I think you can take her certificate. That's great.
Yeah.
Yes. And
So
now,
Kapila is there?
yeah, now I wish to invite Dr. Kapila. Please announce the name. Dr. Kapila. Where are you, Dr. Kapila? Yes. I unmute you. Yeah.
Thank you, sir. Good evening, everyone. It is my immense.
Strong voice.
Yes, sir. It is my immense pleasure to be associated with SPAA India and Core Physio. Thank you, Devaruda sir, and thank you, Gopa sir, for making me a part of this convocation.
Always.
I would like to announce the name of Dr. Farah Hussain. Farah Hussain.
Yes, Farah Hussain. Can you see her?
Farah.
Yeah, she is here, sir.
Yeah, Farah.
No, not she.
He.
It's he.
It's he. It's he. Okay.
Farah Hussain.
Farah
Okay.
Hussain.
Yeah. How are you, man?
No, I think he's
No,
he's unmute. He has to unmute. He can't unmute. He's not able
yes,
to
sir.
unmute.
He can unmute himself.
Where is he? If he open his video, then I can.
Farah, please open your video.
Yeah. Now we can. Yes, Farah. How are you, man? Now you can unmute. Yes, please unmute yourself. Yeah.
Yes,
How are you?
done.
Yeah, good to see the smile. Dr. Pratibha, give us a smile. Yes, give us a smile. Just thumbs up. Yeah. Man, You are a people behind the every sports person. You bring back on track after their injury. That's big and good clapping to all of you. Wonderful, wonderful. Yeah, Kapila second.
Now the second name is Ashwini Kumar.
Ashwini Kumar. Yes, please, Ashwini Kumar.
No, Ashwini Yadav, I think. Yeah?
Okay.
Ashwini Kumar, sir. It is written over here as Ashwini Kumar.
Okay, okay. Ashwini,
Yadav.
I thought.
Ashwini Yadav is here. Ashwini Yadav.
Yes, he's there.
I unmute him.
We can't see you, sir.
I'm out of station.
Okay.
Some difference from my side. But I'm really thankful to Goku sir for such a valuable information regarding the ACL injury. And I enjoyed the course a lot. We will explore new innovation as a coach because it's our responsibility to take care of every aspect of a player. Thank you, sir.
We wish you a bright future. Thank you. Thank you, Dev sir. Thank you, Gopa sir.
So nice to you. Now, Dr. Gopa, you announced that two name.
Okay, I will announce one name and I'll give one name to Himanshu.
Yeah, Himanshu. Hey, man.
So I will announce the name of Juhi Banerjee.
Yeah. Juhi Banerjee, can we see you? Yes. Great.
So Adri's wife. Adri is not there, so his wife is Juhi.
Hi, Juhi. How are you?
Hello, sir. Hello, everyone, and thank you so much for basically making us part of me and making me and Adri part of this forum. So it's a big thank, and nothing better than that, sir. It's Gopa sir, you who is basically recognizing us. It's been a great learning, and it's a never-ending process. You are a great teacher, and I would like to associate you with you in different forums and learn more from you. Thank you so much.
Thank you.
Very nice. Very nice. Juhi, you're assembled with PT Usha. Big thumbs up to you. That's great. That's great.
Thank you.
So
proud. Thank you so much.
Thank you. So I wish to listen some views from Anna. Anna, how are you? Just share your views about this convocation, this webinar. Please. Yeah. Yes.
Hello everyone, thank you very much. That was nice presentation. So I would like to thank all participants and congratulate everyone who gets certificate. So I hope our cooperation will have long way and we will cooperate in different aspects of sports medicine and physical rehabilitation. So we are ready, me and Dr. Tigran are ready to cooperate with you, and we are looking forward for our classes to start, seminars, international seminars. Thank you very much.
Yeah, I invite to Dr. Kanika, Ms. Kanika Chopra. Yes, Kanika.
Dr. Dev, there is one more certificate by Himanshu.
Okay. Yeah, please. I thought I gave you all.
Himanshu is there?
Yeah, Himanshu. Come. Yeah,
Yes,
Himanshu.
sir.
Yeah.
Yes, sir.
Okay,
Yes,
Himanshu,
yes,
just the name of, there is one certificate on the name of Alagu Bharadwaj. Alagu Bharadwaj. So you can announce
the
that.
name, man. Yeah, Usha Bharadwaj is with us. Yes.
Yes.
Hey, would you like to say something with your smile? Yeah.
So,
I unmute you.
Yeah, thank you. Good evening, all.
Yeah.
Thank you so much for this forum, and thank you to Gopa sir for inviting for this forum. Very happy to be a part of this. Thank you so much, and we have learned a lot from him.
Yeah.
Thank you.
It was a very informative session by Dr. Tigran also today.
Yeah, hi.
Thank you.
That's good.
Thank you so much.
Kanika, share your views.
Many congratulations,
Kanika,
everyone.
she's a director of SPAA India. Yeah, please.
Many congratulations, everyone, for certificates and knowledge from such a great platform, Dr. Gopa and Sports and SPA India. Thank you, Dr. Gopa and Professor Trigran for such an insight on new subject to me, definitely, because I'm now very good at injury management and sports medicine, but I have learned today a lot of things. So I must say that it was an awesome session and it had great learning. Thank you so very much.
Yes.
Thank you.
Now we have
Thank you.
Anuradha Verma from Jammu. Anuradha ji.
Yes, good evening, everybody. Good evening, Davinder sir, and my heartiest gratitude to Tigran sir. I am very fortunate to have you and your words while sitting in state of J&K in India, only with the help of Dev Arora sir. And I am very much thankful to Gopa sir. Your words are always so helpful and valuable to us. I always want to remain in the umbrella of such high dignitaries who are always present to bestow their knowledge to us. Thank you so very much, sir.
Thank you.
Now
Thank you.
we need a word of wisdom from Pratibha Mishra ji, please. Yeah.
Yeah. So I think first let Imanshu sir complete that one certificate.
Oh yes. I'm
I think
excited to
he's
listen to
waiting
you
and the
people.
awardee is also waiting for
Yeah,
the same.
Himanshu, please. Himanshu. Yeah, great man.
So
Yeah,
Himanshu,
please.
you can Himanshu.
Yes, sir.
So I think you can announce Radha ma'am because she's not there, but I can take that on behalf of it.
Yeah,
That's because
definitely.
she's not able to.
And
She's
we'll
not
cheer
able
for
to.
her. We'll cheer for her.
We cheer for her.
Yeah.
Yeah, definitely.
So
I
you
really
can
thank,
tell
SPA
some words
India.
about. Yeah.
I really thank SPA India and Coach Studio for having me over here and having me in their team. And it's really a pleasurable moment for all of us because this is the second chance where we are organizing the convocation online. And
This is
thanks
World
for giving me the
Second Digital
opportunity.
Convocation.
Second digital convocation, amazing.
Worldwide.
Oh wow!
Not a
So this
single.
is
Yeah.
world
You are
second.
making a
Wow, that
history,
is
man.
again.
You
So
are
we
an
are
important
creating
part of
history.
making history. Yeah.
So we are creating history. Amazing. Thank you for making
Yes.
me a part of this history, sir.
So
And
nice.
with great pleasure and joy, I announce the name of Radha Madam. I request Gopa sir to please accept the award and the certificate on her behalf. Gopa sir.
Yes. Yes, I accept Mrs. Radha Krishna Sami, her
Just you
certificate,
can share.
and
You can.
it's not as a part of my student. It's in fact she's very elderly person, and I respect her that she has been part of my course, and she's inspiring everyone in this sports industry. So
And
and that's a proud moment. It's a proud moment for me to accept on her behalf.
Yeah, and I'm happy to announce that Dr. Gopa Kumar with on our board with the Armenia University, then Tigran and Dr. Gopal cheer for all of you because we got document little bit late because the process is very high. Documentation process were always and always. So Dr. Gopa Kumar, you are welcome in this international relationship also.
Yes.
So,
Congratulations.
within
Thank you, Dr. Tigran.
within
Best to everyone.
1 month we can complete the documentation, right? So
Yes.
Dr. Gopa Kumar is with this international relation also. Wonderful. Yeah, Dr. Payal and Dr. Rajkumar ji, we love to listen you also, your shower of
Yes, sir.
blessings for all of you.
Yes, sir. Thank you, Dr. Tigran, for your wonderful session. Thank you, Dr. Gopa Kumar, again for a wonderful session. And I'm blessed to see Pratima ji here. And I'm really honored to be the part of world's first and second convocation ceremony all around. And thank you, Dr. Devendra ji, for making me part of this. I can't express my words. And thank you so much, all the dignitaries.
So nice.
Sir, I would like to add something here.
Yeah, please.
Here, actually, we all are here united because of Dave, sir. So credit goes to him. A big cheer to our president
So nice,
who has made this possible. So big
so much.
thanks and gratitude from entire team. I never felt that I'm a newcomer in the family. He has welcomed in such a manner that we are known to each other very well since ages. It's a wonderful experience.
True.
Very
So
good, sir.
you
Thank you
all
very
are
much.
welcome. Yeah, you all are welcome in Pragati Maidan also if COVID allowed us because this is a powerful person,
It will.
powerful wire
We
in the
shall
world.
overcome.
Yeah,
We
definitely.
shall overcome soon.
Soon. Yes, Rajkumar Sharma ji, we need your blessing also and your love also. Always you are a source of inspiration for all of us. Yeah, please, sir. Unmute. Yeah, I did.
Yes, I think it is my pleasure to be the part of this second Digital World Convocation. And I feel honored, Dr. Arora, he has given me chance to meet you all. And really, you can say it is a wonderful initiative by SPAA India. I'm thankful to Dr. Arora ji and the complete, I think, the board. I was the part of this one. I enjoyed this one. Thank you very much. And I think we are supposed to keep it. Khilega India, Khilega India.
So, wow, very nice. So we have a very wonderful person with us. She's a Punita Bohra. Hello, Punita ji, कैसी हैं आप? कुछ कहिए आप भी. Say something. Punita ji, she joined before than me. So she was so excited about the sports physiotherapy and medicine. Yeah, Punita ji, please.
So really, I enjoyed this session. It's a very fruitful session for us. As a physical education teachers, we exactly need to know about the sports medicines and deep knowledge about sports injuries even. Thank you, Gopa sir. Thanks a lot. It was a really nice session. Tegren sir, really learned a lot. And thanks to you, sir, Devendra sir, to give us a grateful chance to listen such a wonderful people around you.
So Punita ji, you always come first. It's my wishes for you.
Thank you so much, sir. Thank you.
Like this. So thank you, wonderful. I think now we have to get a closing remark from a youngest person of this convocation. Now, can anyone raise the hand? Who is the youngest one? Everyone can raise. So Professor Tigran, please. We don't want to end this convocation. It is a beginning. So just over to you. Just say some closing remark to all of us. Yeah, Professor Tigran. Yeah.
Again, I want to thank you, Professor Arora, for the invitation and an opportunity to take part in this session, in this webinar, and also to witness the ceremony, the convocation process. It's a kind of a memorable moment for everyone, I think, and it was a pleasure to witness this also. And I want to express my gratitude again and hope that in the future we will have a large number of opportunities to work together and to conduct new seminars and also work webinars maybe on different topics of sports medicine and sports physical rehabilitation. Thank you.
Yes.
Wonderful. Ruchika Pal, would you like to say something? Because I saw that two person raised the hand. I wish to give the opportunity. Ruchika, just raise your hand if you want to say something. Yeah, please. I saw that two more hands are raised. Then please come on a video. Then you got a chance to speak.
Thank you so much, sir, for making me the part of this SPAA India, and thank you, Gopa sir, for taking the session and enrolling me into this program. And sir, Dev sir, I know about you from Dr. Kapila. She is my batchmate and she is my friend also. She told me
in WhatsApp. Yes.
Yes, sir. So actually, I know about you from the Dr. Kapila and Dr. Gopa sir. And Gopa sir, I know Gopa sir from another workshop in which we organized in February. For last year, sir, in 2019.
Yes. 1 year.
Yes, Saima, welcome.
Yes, sir.
Yeah. Ruchika, continue.
Okay. So thank you so much, sir, for making this the part of the convocation.
Great.
You're welcome. Yes.
Yes, Saima, welcome. Hi.
Good evening, sir.
Today is a Tuesday. This event was organized just for you only.
Thank you so much.
Yeah, Saima, share some your views about fitness. Saima,
It was an
she's from
amazing.
Mumbai.
Yeah, it was an amazing session. Um, it was very insightful. I think from everybody, whoever is related to sports and fitness, it's an amazing insight and a lot of knowledge that was shared by Dr. Gopa and Professor Tigran. Thank you so much for sharing your knowledge. For me personally, it was a lot of helpful insight. Thank you so much.
So nice of
Thank you,
you.
thank you, thank you,
Apu
thank you.
Jamwal, she had a question for you, Dr. Gopa. I share
Yeah.
with you on for private chat. Yeah, Apu, you can ask. You can ask.
You can ask.
Yeah. So even when official meeting is
Hello.
over,
Am I
but
audible?
we can talk to
Yes,
each
yes,
other.
yes.
It's a
Please go
very
ahead.
happy and funniest moment for all of us.
Good
Yes,
evening.
Apu.
Good evening, Ivan.
Good evening. Good evening.
Thank you, Davinder Arora sir, and thanks a lot to Trigan sir that I'm being a part of this SPAA India.
Welcome. You are from Apu?
I'm from Jammu and Kashmir, working in a national Delhi
Wow.
school as a sports
Wow.
teacher.
Yes, that's fantastic.
Oh, very
Jammu.
nice.
You are from Jammu. Great.
And I'm 23 years old.
Oh my God.
I start
Yeah.
working in the age of 19.
Wow, wonderful, wonderful. God bless you. God bless you. Yes.
So I just want to ask one question to Dr. Jan that I'm suffering from complete ACL tear, knee injury.
Dr. Gopal, this question for you.
Is it for me or is it
Yeah.
Dr. Tigran?
Yeah.
Okay.
Apu, just clear.
Dr. Kapil or anyone.
Anyone can.
Okay, so you have ACL tear.
Yes, sir. I am suffering from complete ACL tear from last 2 years, but doctor suggested me to operate my knee.
No, how do you know it is a tear? Is it on grade 1, grade 2, grade 3? What is the grade?
Actually, I play MMIs.
Okay.
Sir,
Yeah,
basically my game is MA.
no,
Mixed
I'm saying what type of tear? Did you consult someone? Did you consult your physiotherapist or your consult specialist, doctor, orthopedist?
Yes, sir.
Orthopedician or whoever it is. Yeah. Did you
Yes, sir.
consult? What is the kind of tear? Is it a grade 1, grade 2? Did they tell it is a partial tear or a
I don't
complete
know,
tear?
sir, but I gone to doctor. He says ki, you have complete ACL tear.
Are you mobile?
I have
Are you
my
mobile?
MRI with me.
Yeah, please. What you do is you can share me. You can
Yes,
get
sir.
my contact from Dr. Dev, and you can send me the documents, whatever it is, and then I can help you, because there are a couple of things to be known before we understand that it is a kind of tear, and why is it given for a surgery, right? So those things can be it's elaborating.
Sorry, sir,
We need
I'm
to have
not able to hear you properly.
Don't
Can you
worry,
hear me?
Apu. You just share with me information. I will
Yeah,
discuss.
sir.
Yeah. We
Yes,
can
yes,
give you a
yes,
good
yes.
solution. We have a Vamshi Priya Amar from Bangalore also. Vamshi Priya, can you hear me? Vamshi Priya, she's a principal. Can you hear me? We need your word of wisdom also. So if you hear yes, Apu, till then you continue.
No, that's it, Dr. Dev. So you can get the details of her as per her history. We need to understand why they have, told for surgery, or there are a couple of things we need to know, which I think she can share. You can share the number or whatever, and then she can contact me, and then I can let her know where she stands.
Definitely.
Yeah.
It will good for her. Yes.
Yes.
So you are in IDPS, International Delhi Public School. Apu?
I think she has got a network issue.
Okay. So it's a fantastic evening.
Oh,
and
unmute.
fantastic
She's saying to unmute. She's muted up, I think.
Yeah. Once
Yes,
someone
sir.
smiles,
I'm
it
from
means he wants
National
to
Delhi
say-
Public School.
International.
I'm there
Suminder
as
ji.
a swimming teacher.
Oh, great. So big swimming pool or
Yes, sir.
small
Yes,
swimming
sir.
pool? Big one. There's two big swimming pool, na?
Yes, sir. Right now it's on construction, sir.
Okay, I love to be swim in a small swimming pool, which just have a height of 1 feet or 2
Yes,
feet.
sir.
So, Apu, you can share your details to Dr.
Jacuzzi.
Dev Arora,
Yeah.
and we will look into it. Yeah.
All right. So all are you welcome again. We will organize the next week. Organize again a big sports physiotherapy and the sports management and so many plenty of career opportunity in a sports for all of us. So it is a thumbs up for the new beginning for India. Thumbs up everyone. Thumbs up. Thumbs up Professor Tigran. Thumbs up Anna. Yeah, please. So have a nice evening to everyone. Yeah, that's great. Yes, Apu. Good. Thank you so much, everyone. Thank you.
Thank you. Thanks
Right.
a lot
Okay.
Thank you so
for
Great.
much.
everyone.
Yes.
See you all.
So nice.
See you all for the next event.
Yeah. I will share the video of
Thank
this
you so much, sir.
event. Okay.
Bye bye.
Right. Bye. Bye.
Thank you, Tigran. See you, Dr.
See you,
Tigran.
Tigran.
Bye.
Yeah. Bye. Bye, Anna.
Bye, everyone. Bye, sir.
Yeah. Bye. That's good. Okay, Ruchika. Bye. Want to take a photo? Yeah, please. Ragni, bye. Sana Kwasa, Shashi Kanujia, Urvashi Lal, yeah. Vamshi Priya, Amar. That's a fantastic session.